arm away, but you can see it's starting here on the ribs and then it's rolling around to the back.
It's the cutting edge of healthcare technology.
But then we have middle trapezius, and where's its line of pull?
Brenda Cannell teaches her occupational therapy students at Central Piedmont Community College by using the most advanced innovation.
When our students get ready to go out to clinicals, we don't want them to walk into a hospital room and go, oh, this is what a hospital room looks like. Oh my goodness, there's too many machines. I don't know what to do. That doesn't work.
Brenda's class is taking place at the new Leon Levine Health Science Center. It's a game changer for students.
In so many ways.
We were told that we were building a new building and we had an opportunity to build a sim center.
SIM stands for simulation, and the entire fourth floor of the new building is filled with the latest in simulation technology, giving healthcare students a preview of real-life experiences.
The other thing that doesn't work is only practicing on your classmates, because your classmates are the most cooperative patients you're ever going to get.
Nursing students hone their skills in rooms simulating an operating room, birthing center, mother and child simulation room, and trauma rooms. And each is equipped with high-tech dummies, which are more like robotic mannequins.
They talk, yeah. It's Miss Scott doing the talking, usually, through the patient, so it's really cool.
Here we're given different scenarios that may not occur as a student while we're in the hospital, and I just feel like we're given a lot of freedom to make mistakes or ask questions.
She is now in labor, 36 weeks, and she's had a small abruption.
Instructors like Lisa Scott can teach in class or sit just outside the simulation rooms in glassed-in control rooms. They can watch on monitors, record the sessions, and over the intercom toss out various real-life scenarios for students to deal with and hopefully learn from.
Ow, I have a contraction. Ow.
Let me put on gloves.
So this is our labor and delivery room, and we have Victoria, a high-fidelity mannequin who can actually birth a baby. You can control the rate that she crowns. You can control how much screaming you want the parent to have.
So with simulation, it really helps because, we get to actually visualize the patient. They're breathing, you can see what's going on. Their vital signs are up, and I feel like I've learned how to assess a patient much more rather than just seeing the information, like what's normal, what's abnormal. You're getting to see it in real life.
With students taking turns in the simulation birthing room, the rest of the students are back in the classroom, watching on monitors and taking notes. Afterwards, they all discuss the things they did well and what they can improve on.
The worst part about it is you're being filmed, like your classmates are watching you. So I think, we're all going in there a little nervous.
We're not out to get the student. We want them to make their mistakes here. The ability to reflect on their own performance and see really how they engaged with the patient. How did they speak to it? Did they make eye contact? All of that is something that through watching yourself you learn, and that's very different than somebody else telling you did or didn't do something.
Nursing students working towards their 2-year associate's degree to become a registered nurse can expect some good-paying jobs. According to the U.S. Bureau of Labor and Statistics, the average registered nurse salary in the United States is over $77,000. However, in the Carolinas, those numbers are slightly less, with South Carolina ranking 40th among the states in pay, with an average RN salary of about $65,000, and North Carolina ranks 37th, with an average RN salary of more than $66,000. The average for new grads entering the workforce in North Carolina is just under $62,000.
We really believe we've done it as good as anybody. We had a consulting firm who specialized in healthcare help us design this fourth floor. We designed it so that it allows us not only to meet our current needs, but our future needs.
The Sim Center also has a pharmacy, clinical lab, and check this out, an actual apartment where students simulate physical therapy and what it's like to navigate an in-home type of setting. The #1 goal is to give students a better hands-on experience and to create better prepared graduates for the workforce, which will ultimately better serve the healthcare needs of the community.
So I think what we're going to see are more comfortable and confident students who have a better understanding of everything because they've seen it inside and out.
More prepared than I would be if I didn't have this experience.
Providing state-of-the-art education in the field that's only expected to continue growing. For Carolina Impact, I'm Jason Terzis reporting.